every test I did, I can remember being in high school, going under anesthesia to get scopes of my stomach, and nothing would be found. Tons of lab tests, and at best, I would leave those appointments with a prescription that did not help.
Did they ever try to prescribe you medication thinking that maybe this was related to a psychiatric condition such as anxiety or maybe like a mood disorder that were just presenting as these somatic symptoms?
Yeah, I think, as females, especially going into the healthcare space, a lot of it gets slapped as it's just our hormones. So a lot of birth control or hormonal solutions were offered to me, especially dealing with skin issues.
What helped you realize that there was another way?
But yeah, it took a little bit of researching on my own, which I hate that patients have to be their own advocate, but that's the reality of the system.
Welcome to the Root Cause Reset, the podcast where we cut through the noise of symptom chasing and quick fixes and get to the truth about what's really going on in your brain and body. I'm Dr. Trish Schneider, a psychiatric mental health nurse practitioner and functional bloodwork specialist. Let's get started. You ever feel like your body is falling apart, but your doctor swears you're fine? Like you're drowning in symptoms, but somehow still within normal range? Yes, I've been there. And today's guest, she's lived it, and she built an entire clinic around healing what conventional medicine constantly overlooks. Today's guest is Chelsey Leveling, who is a board-certified nurse practitioner, functional medicine expert, and one of the few voices out there who doesn't just slap a diagnosis on your fatigue and call it a day. In this episode, we're diving into her personal story, the root causes behind the most common misdiagnoses, and what really it takes to get your energy, hormones, and sanity back. So if you're sick of feeling gaslit, dismissed, and stuck, this conversation is going to feel like oxygen. Let's reset. So welcome, Chelsey.
Hi.
So, Chelsey, you've made a bold shift from conventional to functional medicine. Can you take us back to what led you down that path, especially through your own health journey?
Yeah, absolutely. So my career had always been in the hospital. I was an ICU nurse. I worked in surgery. So definitely was well aware of what conventional medicine entailed, lots of medications given. I think the chronic stress of working in that, sleepless nights, especially working night shift, took a toll on my own health. I was passed around from specialist to specialist dealing with health issues and wasn't getting answers. And as someone in the health field, I felt like I had all the tools to get myself healthier and I couldn't. I had reached my breaking point. I was in my mid 20s and feeling like no 25-year-old should. I was so fatigued, these chronic skin issues, gut issues, and I found a functional medicine provider in my area. It changed my life. It fixed my issues and gave me my health back, but it also changed the trajectory of my career and led me into functional medicine to where now I can help patients like myself.
That's wonderful. And did you feel like going to a traditional doctor, they just didn't quite get it and just basically told you that everything just looked fine on paper, but you knew deep down it just wasn't?
Yeah, I mean, every test I did, I can remember being in high school, going under anesthesia to get scopes of my stomach, and nothing would be found. Tons of lab tests, and at best, I would leave those appointments with a prescription that did not help. And the follow-up would be 6 months to a year later, where I even felt worse or had worsening of symptoms.
Absolutely. Did they ever try to prescribe you medication thinking that maybe this was related to a psychiatric condition such as anxiety or maybe like a mood disorder that were just presenting as these somatic symptoms?
Yeah, I think, as females, especially going into the healthcare space, a lot of it gets slapped as it's just our hormones. So a lot of birth control or hormonal solutions were offered to me, especially dealing with skin issues. And then, going through them telling them I'm a nurse, I work stressful hours, just chalking it up to anxiety. I was always kind of hesitant to take that stuff because it never made me feel great, but I was kind of desperate. So there was times where I tried it and just really didn't feel any better or had side effects from, what they were offering.
Yeah, absolutely. And when obviously conventional medicine couldn't give you the answers that you needed, what helped you realize that there was another way?
Luckily, social media, I think it's a great tool in that aspect. I just started to research, I have these gut issues and skin issues. What could be going on? And that's when I heard about functional medicine. Even being in the healthcare space, I had no idea that this area existed of a different way to practice. The clinic I went to was highly reputable, and the provider there is very well known. So I was lucky to have that support in the area that I was. But yeah, it took a little bit of researching on my own, which I hate that patients have to be their own advocate, but that's the reality of the system.
It's so true. You're absolutely right because as a nurse and in the medical field in general, we're really not taught to really uncover what the root cause is. What we're really taught is, these are the symptoms and these are the treatments for it, many times involving medication, diagnoses, therapies, which medications can be amazing, but that's really all you're offered. And even we don't take things into consideration, such as, good old fashioned nutrition and, looking at going outside and getting sunlight and making sure that your environment isn't toxic and all of these things that could be contributing to a lot of the health symptoms that people experience. I mean, even nutrition, I don't even remember, like I mentioned previously to people, did I even have a nutrition course? If I did, it was only one, and it certainly wasn't to the level where we're talking about using food as medicine to prevent illness. It was basically using food as medicine when we already had an illness. Like if you have high blood pressure, avoid these things. So it's true, and when people would say to me, "I have done everything, and I've gone to all these physicians. I had my blood work, I had my physical. They tell me everything is fine, everything is normal, but I feel like crap." You're like, "Okay, I must be crazy then
Mhm.
because everyone is telling me everything's normal, but yet I still feel all this way." And it's you know, we're not taught that. And people mention, well, why doesn't my doctor know about these things? And it's really a different way of thinking, right? And
Yeah.
it's really sad, I think, that you really have to do like your own investigating and really find all of these different options,
Yeah, absolutely.
when you're looking for answers, for sure. So,
Yeah. I mean, I can remember one nutrition course in my undergrad getting my nursing degree. And that really was just the basics, learning about vitamins in certain foods, but we didn't go into all of these triggers that, our body could have. And food looks so much different today than it did 30 years ago.
absolutely.
Sometimes you'll go to the doctor and they'll tell you to stop eating certain things, but I think a lot of patients are owed an explanation of why. And that's really what I try to do is I feel when they have a more empowered and educated decision to make, it's easier to make that than just being like, "Oh, well, you should stop eating gluten. It's not good for you." Helping
Absolutely.
them break it down of why their body might not tolerate it can help them then make a better choice when choosing different foods.
No, absolutely. What did you find was the most surprising thing that you discovered about your body or healing once you stepped into root cause work?
I think different from conventional medicine, your body works as a whole. So, what might look like a skin issue or a mood issue was tied to my gut health, and that was being impacted through hormonal changes, these skin rashes I was experiencing, and this anxiety that I hadn't had before. our gut is a brain to our body, and that is a lot of the root of these chronic conditions. It can cause metabolic issues where you gain weight. It can cause autoimmune issues because your immune system is made in your gut. Your skin is our largest organ. So if there's internal infections in your gut, that can come out on your skin. So I think really breaking it down and realizing your body is a whole piece together, and it's not just your brain and your bones and your muscles. And we have to look at it as a working system together instead of isolating these different areas.
Absolutely. And the gut, it's so fascinating. It truly is linked to just every possible medical thing. Who knew how important it is to have a healthy microbiome? As you mentioned, linked to, skin things and mood, even thyroid, thyroid disorder, all of these things that you would never really think about. But it's true. There's so many things that are all linked to the gut. And if we could just find ways to really support that and make that as healthy as it could be, we could really prevent a lot of, the health symptoms and the diseases along the way if we just really had a better understanding of how to really support that in the best way that we can.
Yeah, well, that comes too back to the nutrition piece. I think we're seeing so much more chronic illness now because, again, the food is not the quality it used to be. We're eating ultra processed foods that have no nutritional value. Our stomach needs fiber that feeds all of the good gut bacteria. And most of us just aren't getting enough of the nutrients needed for filling, a healthy gut.
Yeah, no, absolutely, absolutely. And yeah, myself included, eating stuff, on the go and eating stuff that's quick that you can just microwave, and all of that. And it just leads into um just not really supporting your gut microbiome as best, as you can, and especially water too. Like when I realized how many chemicals were in my town tap water, it was truly shocking. So definitely did a lot of changes with nutrition and with just simple things like that that, we can do. I mean, we can't, of course, ever truly prevent living in a toxic world, but these small things that we can do can certainly add up over time.
Yeah,
Um,
absolutely. And it all matters. Starting where you can, if whether it's changing nutrition or filtering your water is at least better and gives you a less toxic burden than what your, previous would be.
yeah, absolutely. Absolutely. So, for those who might be new to the idea of functional medicine, how would you explain the difference between treating symptoms and getting to the root cause?
I always say we're more of those curious providers. So I want to know why your body is having these symptoms. It's not normal to have headaches or skin rashes or stomach issues. That is your body telling you, hey, something's going on. So instead of giving medication to suppress your body telling you, hey, help me out here, I do diagnostic testing to figure out why. So we will look at your gut health, your hormones, thyroid levels, any type of advanced testing we can do to figure out, again, what's causing your body to start to show these symptoms. And then instead of, again, a one size fits all approach or a band aid approach, we really break it down and personalize our care. So each patient will get a certain nutritional protocol to be put on. We educate on lifestyle management if that needs to be more exercise or stress reduction. And then we utilize supplements, which is a more natural way of treating the body to get it back to balance instead of just, again, putting a band aid on that. Our philosophy or goal is to basically restore your body and help it get there. Um, you don't have to be on these protocols for forever. We just want to give your body the support to get back to where it needs to be.
That's wonderful. Are there certain signs or patterns you see often in patients who've been told everything looks normal, but they still don't feel well?
Yeah, I mean, I would say the biggest complaint or concern is always fatigue. My patients just feel more tired than what they should, especially for their age range. or that hormones are out of balance. And again, when they're told their lab normals are fine, these are lab ranges that we're basing off of an unhealthy population. I think we can all see that, the Americans aren't the standard of health, and these are ranges that we're telling patients are normal. So even if a patient brings lab work to me that another doctor has told them is normal, sometimes for me it's not, and I see like, hey, your vitamin D is way lower than what I had wanted, or your thyroid level is, much higher than it should be. So that's also a different reference range that I utilize and look at because we want optimal health. We just don't want someone to be functioning.
Mhm. Yes, at the bare minimum, which
Yes.
many times it is, especially vitamin D.
Mhm.
When you're 30, yeah, you're technically within normal range, but to really have your immune system and to feel your best, right, needs to be closer to 50 or 80, but not too many of us, are anywhere close to that.
No, I would say 9 times out of 10, probably 100% of the time, unless someone is supplementing with vitamin D, they're always chronically deficient. And it seems so simple, but vitamin D is so necessary for so many things in the body. It helps with blood sugar regulation. For females, especially, it's a precursor to hormones, our immune system. And where females are more, exposed to and likely to develop autoimmune. So that's a really easy and important nutrient to keep up.
And would you say those are the most common underlying issues that you're seeing right now?
Nu-
Fatigue and
oh,
autoimmune?
yeah, fatigue, autoimmune, a lot of women's hormones are, just not where they should be. Lots of gut issues, and then thyroid.
And when you take on new clients, do you redo their blood work, or do they bring you their previous labs?
They certainly can. However, also, if you've gone to your PCP, they're typically only running a CBC, a CMP, and some other standard markers. The functional panel that we typically run on our patients is about 6 pages of blood work, which is so
Hmm.
much more blood work than they've ever had before. So I like to see previous blood work to see if there's any trends that I see, but I'm usually going way more in depth and in detail to figure out, again, more issues.
Hmm. Perfect. You often work with people who've been dismissed or misdiagnosed. What does it look like to finally be heard, and how do you approach care differently?
Yeah, I think a lot of people come to our clinic as their last resort. So they do feel pretty hopeless and kind of like, well, how can you help me? No one else has been. I try to really be understanding because I was a patient in that place too. I try to, instill trust in them that this is a different area, and they typically see how much time and dedication we give to our patients, which makes them feel more at ease. Their first initial consult is an hour, which is more than they've probably ever gotten with a provider. And then going over their labs is another hour. So we really want to make sure that each patient understands the why to what's happening. We want them to be a participant in their health. We don't want them to be just told, you have X diagnosis, you take X medication, and see me in a year. I think that's what builds that meaningful change in patients to get them to their long-term healing goals.
Wonderful. And when you take on a client, how much time, um, are they in your care from like beginning to the time that they're well on their way to wellness?
Yeah, well, it really depends. It's very personalized care. So if I have a patient with some gut issues that can take 3 to 5 months, but there's patients I've worked with for 2 years since I've been at the clinic. Some of these patients have been dealing with chronic health issues their whole life, and there's times that that's just not undone in 4 to 5 months. But we really are a participant throughout their whole health journey. Doesn't mean that they don't feel better within the first couple months. It's just if we really want to peel back and fix their body, it takes time to heal, especially when it's been a long, long issue.
Sure, especially because it didn't happen overnight too.
Indeed.
Occurred
Yeah.
years over years. And what do you want patients to know when they feel frustrated, lost, or overlooked by the system?
Definitely, I understand. It's not set up in a world to help these chronic conditions. It's more of an acute system, which is great for life saving medicine. But we are failing patients at preventing these issues from happening in the first place. But there are other alternatives. And I know some people are resistant to that change and think that, what's changing my diet going to do to help? But there's so much research being thrown into this area of medicine because of the amazing results that patients have seen. So just have a little bit of trust and understanding that you might have to be a little more open minded, but we're doing this to get you results and feel better.
Mhm. Do you ever get any pushback from any clients in any part of the treatment or the protocol along the way?
Yeah, I would say sometimes there's pushback. I mean, and it's totally understandable. We live in a busy, busy society where we're constantly on the go. So, asking people who have children to take care of to work out and meal prep, it's hard. But I try again to be a big educator on why these things are so important. They're foundational for our body. And sure, supplements can help, but if we don't fix those foundations, we're not going to get you to the results that we want. I think the pushback just comes from, again, never really getting real results or answers and being a little hesitant to make these changes, not knowing what's on the other side. We try to give, patient testimonials to help people who are new to this to know what's ahead and that there's been other people in their shoes that get results as long as they put in the work.
Yeah, absolutely. For someone who's tried protocols, diets, or has seen multiple doctors with no results, what should they consider when looking for true root cause support?
My mind always goes to what are we missing? Is there a test that hasn't been run? Is it Lyme or mold that we haven't picked up on? Is it their nervous system that no one has really addressed? Is it something in their environment that we haven't figured out that's keeping them sick? Your body should be able to heal. So if it's resistant to that, we have to again figure out the why. What is causing these ongoing issues that aren't changing the way that they should with a typical protocol?
And mold is such a big factor too that often many times gets underlooked or not really thought about as well.
Yeah. I live in the Carolinas. It's a very damp environment. So we see it a lot. And even in newly built homes, now they use a lot more cheaper materials than they used to. So a lot of patients will be like, oh no, like I have a brand new house. And I'm like, that could actually, make things worse,
Yeah.
or if it rains when you're building and it's not properly taken care of, but it causes so many health issues that
Mm,
I see day in and day out, and it can be really hard to get rid of. But it is a huge issue I see with my patient population.
yeah, absolutely. Mm. What's one common myth about health that you wish more people understood?
I know people are hesitant to these woo woo things, but, there is research to back that stress management and moving your body, all of those things can certainly help. I think we're always looking for that big factor to fix us, whether it's the newest supplement or newest medication or a vibration plate, something that seems like the answer to everything. But I think if we peel back and realize, 60, 70 years ago when we were waking up with the sun, getting out and exposed to fresh air, moving our bodies need that. And we live right now in a state where we're not giving it the tools that it needs to function the way it should.
Yeah, I definitely agree with that. It really comes down to the old fashioned basics like get up, get some sun on your face, move your body, eat food that's been locally grown with, as little, processed and chemicals as, you know, there could be, and that it's a journey, right?
Mhm.
You have to put in the time, you have to put in the work, and nothing comes quickly. I find that people want the fast results, the quick things,
Mhm.
and it is a myth. It's not going to happen quick. It's not, if you want to run a marathon someday, you're not going to be able to just go out there and run once and then be able to do it, right? You have to slowly build up to that, and then eventually you're going to see, how much better you're going to be at running, and eventually you're going to be able to do that. So I
Mhm.
think health is the same thing. It's this journey.
Yeah.
And I think people are just expecting, like, all of a sudden, like, it's just going to happen, but it does take a mindset, right?
Well, yeah, and you
Um,
have to wake up every day and choose to move your body and eat healthy. It's something that's going to have to be a decision for the rest of your life. And you can choose that hard now and then it becomes easy, or the hard will come later in life when you are a type 2 diabetic, have heart disease and autoimmune disease that can eventually lead to cognitive decline. So it's hard to predict what happens in the future, but every choice you make when you're younger is going to reflect what your health status is in the next 10, 20, 30 years.
Absolutely. And definitely there's an emotional and a psychological side of healing as well. And mindset does play a role in long-term transformation,
Mhm.
and that you have to, buy into that. And if you believe you're going to get well, you will. So all of those components have to be, intertwined and readily available in order for you to be able to achieve the goals if you really want it,
Mhm.
you
Yeah,
know?
and I think most patients have the most success when they've gotten to a point that they are willing to do whatever it takes to get there. The ones that I see maybe don't make the most progress is because they're resistant to those changes. They're not at that level of desperation to where they will do whatever it takes to feel good, but eventually they could be. And I wish I certainly could have made changes sooner had I known before I got to the point that I was. So I always try to tell people, if you're noticing small symptoms, like, just have a check-in. It's like your check engine light going on in your car. It's not completely broken down, but something is wrong that might need a tweak before we end up
Yeah.
with a bigger problem.
With a breakdown. Yeah.
Correct.
Yeah, for sure. For the person who's listening, who's tired of trying, tired of not being believed, what's the first step that they can take to move forward with clarity?
Have an open mind. Our team at the Functional Health Center of the Carolinas is definitely open and willing to take new patients. We have an office in Fort Mill and Mount Pleasant, but doing your research, it can certainly help. But I think you need a team of people who are experts in this field to guide you along the way and make sure that you're getting answers, number one, but having a team of people to support you along the way is important as well.
Right. What does true healing actually look like in your experience?
I think it's different for everyone. And I think that's a personal journey for my patients. I always ask them what their goals are. I can look at their labs, and my goal would be to not make them a type 2 diabetic and to get their inflammation markers down. But for some people, they don't care about that and they just want to be able to play on the ground with their grandkids. And that's something that I'm going to help support them with. So I think it's important for every patient to be listened to of what health looks like for them. And then I can come in and educate what their labs look like and what I would want to get them to. So that way we can prevent further disease.
Right. If there's one message you want every listener to walk away with today, what would it be?
I think this area of medicine is going to become the new standard of care, which I hope it is.
Be
If
amazing.
Yes, so I would say if you have been dismissed, feeling frustrated, not getting answers, this is not all in your head. Symptoms, again, are your body's way of telling you something's wrong. And let's try and start being proactive about our health instead of reactive. Let's figure out these issues before they become a bigger problem to where they're affecting your overall quality of life. And the area of functional medicine is that we want to take a proactive approach to health versus reacting and just giving you a band aid. We want you and your body to get back to how it should operate.
Great. And Chelsey, if there's anyone out there that wants to know more about your work, get in touch with you, where can they find you?
Yeah, so our website is fhccarolinas.com. Can also find us on Instagram. We are FHC Carolinas. Again, we have an office in Fort Mill and Mount Pleasant, and our office phone number is 704-625-2994. If you'd want to call and get on our consultation list, our providers would be happy to meet with you and get you some answers.
That was great, Chelsey. Very valuable information. And I want to thank you so much for joining me today and just giving us all just some really good tips on ways that we can just continue to look for answers to true root cause healing. So that's it for today. Join me for the next episode of The Root Cause Reset. I'm Dr. Trish Schneider, a psychiatric mental health nurse practitioner and functional bloodwork specialist.